Taber's Cyclopedic Medical Dictionary. Stroke 1. A sharp blow. 2. To rub gently in one direction, as in massage. 3. A gentle movement of the hand across the surface. 4. In dentistry, a complete simple movement that is often repeated with modifications of position, strength, or speed, perhaps as a part of the continuing activity. For example, the closing stroke in mastication when the jaw closes and the teeth come together. In scaling of planning the roots of teeth, the scaling instrument is introduced carefully into the subgingival area in what is called an exploratory stroke, perhaps allowed by a power stroke designed to break or dislodge encrusted calculus. This is followed by a shaving stroke intended to smooth or plane the root surface. A sudden loss of neurological function caused by vascular injury to the brain. Stroke is both common and deadly. 600,000 strokes occur in the U.S. each year. The disease is the third leading cause of death worldwide. Because of the long-term disability it often produces, stroke is the disease most feared by older Americans. In the United States, 80% of strokes are caused by cerebral infarction. Example, blockage of the carotid or intracerebral arteries by clot or atherosclerosis, intracranial hemorrhage, and cerebral emboli are responsible for those most other strokes. Innovations in the management of stroke, example in prevention to early use of the thrombolytic drugs, vascular ultrasonography, and endarterectomy, have revolutionized the acute and follow-up care of the stroke patient. Apoplexy, brain attack, cerebral vascular accident, carotid endarterectomy, intracranial hemorrhage, transient ischemic attack illness, hemorrhagic stroke, bleeding into the brain, seen on non-contrast head CT, courtesy of Harvey Hatch, MD, Curry General Hospital. Etiology, risk factor for stroke included advanced age, especially greater than 65 years, hypertension, carotid artery disease, cigarette use, hyperlipidemia, diabetes mellitus, atrial fibrillation, a history of myocardial infarction, atherosclerosis of the aortic arc, and possibly hyperhomocystinemia. Symptoms. The National Institute of Neurological Disorder and Stroke lists following symptoms as warning. Signs of stroke: a sudden weakness or numbness of the face, arm, or leg, suddenly loss of vision by dimming of vision, suddenly difficult speaking or understanding speech, suddenly severe headache and suddenly falling gait, disturbance or dizziness. In clinical practice, stroke patients often present with more than one of these symptoms. Example, limb paralysis and aphasia, severe headache, and body deficits. It is also important to note that these symptoms are not specific for stroke. Sudden dizziness or gait disturbance can occur as a result of intoxication with drugs or alcohol, for example, and sudden severe head pain can result from cluster headache, migraine, and many other disorders. Treatment: acute ischemic stroke can be treated with intravenous tissue plasminogen activator (TPA) if the disease is recognized as the first 90 to 180 minutes and intracerebral hemorrhage has been excluded with CT or MRI scanning of the brain. This form of therapy is not without risk. Thrombolytic drugs can reduce long-term disability and death by 20%. By acutely triple the risk of brain hemorrhagic strokes, which have about 50% mortality, can sometimes be treated by evacuating blood clots from the brain or by repairing intracerebral aneurysm. Prognosis. The prognosis is directly related to the degree and length of time blood flow to the affected area of the brain is deficient or completely blocked, and to the region of the brain affected by the stroke. Patient care. Acute phase. The medical team, including physicians, nurses, acutely, occupational therapists, physical therapists, and speech therapists during rehabilitation, obtain a physical and neurological status exam to obtain baseline measurements. Focus is on the maintain appropriate time, life support functions, and on early intervention to prevent long-term sequelae of prolonged bed rest and response to neurological changes in muscle tone and motor function. A patent airway is maintained and adequate ventilation and oxygenation are provided. As necessary, the trachea or pharynx is suctioned gently to remove secretions. The patient is position is the lateral or semi-prone position with the head elevated 15 to 30 degrees to decrease cerebral venous pressure. Neurological status: Glasgow Coma Scale, vital signs, papillary responses, respiratory patterns, and sensory and motor responses to verbal, tactile, and painful stimulation are monitored for signs of deterioration or improvement, and findings are documented on a neurological flow sheet. A history of the incident is obtained, including time frame related past medical history, hypertension, use of anticoagulant drugs, cardiac dysrhythmias, and associated injuries. The patient is prepared for prescribed diagnostic studies, including computed tomography or magnetic resonance imaging, arteriography, and lumbar puncture.